My name is Shingi. I'm one of the co-founders of Primal Red. One of the biggest political hot-button topics today is healthcare. More specifically, government-provided healthcare coverage. On the one side, we have a group of people who believe that coverage should be universal. And on the other, we have a group of people who believe that for financial reasons, universal coverage is not financially sustainable. Now, no matter what side of that issue you are, I think the most important thing is to first question the core assumptions that are within that debate. The assumption that should be questioned is whether it is fair to assume that coverage is a guarantee of good health. Because if coverage is not a guarantee of good health, should we be talking about coverage, or should we be talking and having a conversation about better health? There are two pieces of statistics that lead me to believe that the assumption of coverage being a guarantee of health is a bad assumption. The first is that in the United States, we spend about $2 trillion a year on health services, and 85% of that cost is driven to care for 15% of the population. The second statistic is that for the average primary care regular checkup, the doctor spends an average of 8 minutes per visit with each patient. But the problem is that we don't want a sick care system. We don't want a healthcare system that only pays attention to you when you're on the verge of death. So why is our healthcare system like this? Why is coverage not a guarantee of quality? To understand that question, you have to look at who the dominant factors are within the healthcare market. And you should look no further than health insurance companies. When they were first being established, almost 60 years ago, health insurance companies were essentially for people whose primary interaction with the healthcare system was when they had an unexpected event, a heart attack, an accident, etc. Now we fast forward 6+ decades and we see a very, very different population health situation. We're in the midst of a chronic disease epidemic where over 45% of the adult population has some chronic disease. And we also have an opioid epidemic where drug abuse has become a massive issue that's driven a lot of healthcare spending. We want a healthcare system that can keep us healthy. Especially if you have concerns or family histories of heart disease, diabetes, or some other chronic disease, you want to be able to be aggressive and proactive in preventing those things from becoming problems 20, 30 years from now. Our current healthcare system is not financially aligned to help with this. So that's why we created Primal Red. Primal Red is a marketplace that allows people like you who are interested and want to be proactive about their health the ability to take control by accessing services that are related to not just your physical health, but your emotional health and your financial health as well. These are services that you can get at affordable prices that allow you the flexibility to not be dependent on an insurance company or on the government to make sure that your health is where it needs to be. You can find out more about us, you can download our app at www.goprimalred.com.